I would like to introduce our next speaker. She is a brilliant woman. She's VP of our content strategy practice at MadPow, and I joke that she is a counselor for our clients. Content, if you've ever worked on a large-scale initiative, can be a bear, right? We have old content, we don't know what to do with it, there's processes, how do we work with it? And so basically, clients have a therapy session with Marli where she helps them sort it all out, and she is like the wind beneath their wings. So she is unflappable, and she's here to share with you some points on health literacy. So please welcome Marli.
Good morning. My family has spent a lot of time navigating the healthcare system this year. For my brother, it's just day-to-day life. He's a nurse practitioner in the ER, and he sees patients every day. But lately, it seems like a lot of his patients either don't care about their health at all or have something else going on. He had one day where his first patient had originally gone to urgent care and had been told, you have dangerously low blood pressure, you need to get to the ER immediately. So now he was at the ER a week later. His second patient was a 21-year-old woman, pregnant, who had been at the ER 4 days earlier with abdominal pain. She'd refused all care, had gone home, been asked to come back 12 hours later if she was still feeling pain, skipped the follow-up, now 4 days later had worsening abdominal pain. His third patient had dangerously high blood pressure, or maybe not dangerously, but it was a condition that would need some management. So my brother worked with him, showed him some processes for caring for his condition. They went through everything. He gave him the discharge paperwork, explained that there were answers to more of his questions there, and also got him a parking voucher that he'd asked for. Then he watched as the man walking out the door trashed the whole thing. He actually ran after this patient and said, hey, your parking voucher was in that paperwork you just threw out. And also that discharge paperwork, that's all the stuff we were just talking about. This is important. And the guy said, oh, right, dug through the trash, pulled out the papers, separated out the parking voucher, threw the rest back out. And my brother's right. These patients are either just not caring about their health or there's something else going on. And that something else is health literacy. 88% of American adults lack what we consider to be proficient health literacy. That means that in a room of 100 American adults, 88 of them are unlikely to know how to stay healthy or care for a chronic condition. This is not an edge case. This is not something we can overlook. And yes, health literacy is lower among those in minority groups or of lower socioeconomic status, but it affects all of us. It affects people based on their cultural background, their ability to listen and to communicate clearly. Also on their past experiences, their cognitive abilities, their mental health. But also it's influenced by how tired you are, how busy you are, how much your phone is buzzing during your appointment, how loud the room is, how busy your doctor is that day. It affects those who have PhDs and those who didn't graduate high school. Rich and poor, old and young. Let's take, for example, a 27-year-old woman, a well-paid job, a manager in health services. She's smart, she's athletic, she's my sister. She had some issues with her shin in March, and she didn't really want to go to the doctor, even though she has good health insurance that covers just about anything she needs, because she was afraid the doctor would tell her she couldn't do her next race. Now, of course, with a brother who's an ER nurse and a sister who works at MadPow, we said, no, please, go to your doctor. And she did. And her doctor did a series of 2 x-rays. The first x-ray was inconclusive. The second x-ray, her doctor said, well, looks like you're having a stress reaction. And you should see a PT. She also, being an advocate of shared decision-making with her patients, sent my sister all of the x-ray results through a patient portal. My sister got the x-ray results, took a screenshot, sent it to my brother and me, and said, what is wrong with my leg? This is literally what she received in the patient portal. And she said, should I be concerned about this cortical thickening? Is that going to be a problem? Do I have a stress fracture? Or is it says that there's There's no discrete fracture. Is there actually no problem? Do I still need to see the PT? Now here's the thing. My sister is an athlete. She is a PT she knows and loves and trusts, who is easy for her to get to and has a low copay. But if she'd had to find a new PT if she had never had one before, she wouldn't have done it because she had no idea how to explain what was wrong. What we have here is quite simply a failure to communicate. We have a dedicated provider who provided all of the information to try to facilitate shared decision-making, but there was no context in that portal. And for us to provide patient-centric, autonomous care, we're assuming a level of health literacy that just doesn't exist. To the point that about 10 years ago, maybe more now, maybe 15, the AMA Foundation did a study on this and created a video sharing the stories of quite a few people's health literacy issues. Here are their stories.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
We had a child that was physically handicapped that I had to do physical therapy on. I would show up on Tuesdays instead of Thursdays for the appointment. I would be exercising the wrong side of the body.
I had an abscess in a ear one time. Well, I had to fill out forms and I couldn't fill out, so I didn't go. I come back home. I ended up having to go to the emergency room that night because it burst.
Health literacy is a big issue. And it's more than the ability to read and write. It's not just literacy. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and the services needed to make appropriate health decisions. And a lot of these health decisions are made in the grocery store, or at home, or in a restaurant, or at work, or at a pharmacy, or in the car, or at the gym. They're about what food to eat, what over-the-counter allergy medication to buy, whether or not to give your sick child medicine or wait until morning, what health insurance you sign up for, or whether you run that extra mile or have that glass of wine with dinner. These are not decisions that are made face-to-face with a provider. And that's why health literacy is broken into categories. We start with basic, functional health literacy. Basic health literacy implies that you understand the terminology, that you can fill out a form. But then there's a level above that. There's interactive or intermediate health literacy. This is the implication that you can ask questions of your doctor and know and be comfortable with that and know when you might be able to do a Google search to find out information or what specialist to ask things of. And that's still not enough to be able to truly manage a chronic condition or keep yourself healthy. What you really need is proficient health literacy. Critical thinking and analysis skills, the ability to not only ask for a second opinion or a third opinion, but take those different opinions, evaluate them, and understand what they mean in terms of probability and risk assessment. This is a big issue. And what's more, according to research, inadequate health literacy more strongly predicts health status than age, income, education, or race. It's associated with better health outcomes, and as a result, with the costs that you may incur and the status of your day-to-day life. When you have better health literacy, you're more likely to pick up on the symptoms of a chronic condition that may change over time. You're more likely to recognize if someone else has symptoms of something that you don't want to catch. And so you're less likely to get ill. Or if you do get ill, you're likely to catch it sooner, and so have less severity. You're also less likely to make a mistake with medication that would result in you ending up in the ER. In 2011, there was a study in Chicago, and 2/3 of the participants wouldn't take pills together if one label said take twice daily and the other said take every 12 hours, even though those two things mean the exact same thing. And every time that we talk about this, we talk about the individual's health literacy. We talk about their ability, as though we're judging them, as though it's their responsibility. Well, guess what? The onus is not on them. It's on us. It is our responsibility. Harold K. Coe, the US Assistant Secretary for the HHS in 2010 under Obama, he knew we needed to do more. He said that health literacy in the US reflects what health systems and professionals do to make health information and services understandable and actionable. We've moved from doctor as decision maker to doctor as guide. We're empowering our consumers and our patients, but they're only empowered if they understand their options and how to make the decisions. And you know what? We can do better. We owe them more. We've known this for a long time. In the late 1800s, William Osler, the founder of modern medicine, said that the good physician treats the disease where the great physician treats the patient who has the disease. The 1800s. This is also the man who told us, listen to your patient, he is telling you the diagnosis. He was advocating for hearing patient histories, for holistic care. That's a challenge today. A lot of providers only have 15 minutes with their patients. Many of us work in areas where we don't see patients at all. And yet we're trying to do more and to help. A friend of mine, a cardiac surgeon, who's a specialist, she was told by some of her colleagues that she better find a subspecialty because the amount of time she was taking with patients just wasn't allowed. She wasn't seeing people who were really that sick. And yet we advocate for preventive care in the same breath. It's complicated. Atul Gawande knew that. He wrote an entire book called Complications. He talked about how we look for medicine to be this orderly field. We look for it to be cut and dry, clear, science. And he says, there's science in what we do, yes, but also habit, intuition, sometimes plain old guessing. He talks about the gap between what we know and what we need to know, what we do and what we aim for. That's what complicates matters. And we must do better. We owe it to our patients. Still, there's hope. The National Action Plan for Health Literacy was created under Harold Cole at the HHS in 2010. It's based on two principles. First, all people have the right to health information. It's a good principle. Secondly, health services should be delivered in a way that promotes quality of life and longevity. Based on those two principles, they created 7 goals. And those goals range from how we could better disseminate information to the need to improve health education, both in the K-12 system and in adult education. There's a goal based around connecting communities with payers, with providers, and there's a goal, particularly near and dear to my heart, about increasing basic research and the development, implementation, and evaluation of practices and interventions to improve health literacy. And there are a number of programs that have been created between 2010 and today. For example, the Centers for Medicare and Medicaid Services launched a series of grants in September 2016 under the Transforming Clinical Practice Initiatives. Those grants have funded programs in almost every single state. They're mostly peer-based learning networks, mentorships, coaching, all sorts of things to train clinicians on how to develop core competencies around improving health literacy. One of the programs through this grant is Sigma, a global network for nursing. Now, this particular program had very specific goals. They wanted to improve patient satisfaction with nurse communication and with hospital discharge. And they succeeded. Over a 2-year period, patient satisfaction with nurse communication increased from 75.9% to 84.6%. Satisfaction with discharge information increased from 84.6% to 98.6%. Now, this is great, and nurses certainly have more time often with the patients. But it's also important to remember that if we're going to be giving them these additional responsibilities, that means that there are other responsibilities that might move on to nurses' aides or technicians or even into roles that we haven't even created yet. We're talking about a systemic overhaul. Then there are more digital interventions. For example, Health Current, which works on integrating systems, assisting with EHR adoption, and using technology to empower clinicians. They believe that more complete information is more meaningful and leads to better care and better outcomes. And that's great. They're working particularly on things like combining sources of information, like improving the written materials, but also having patient interviews. And then we have the purely digital initiatives. Cancer.net teamed up with a company called Visible Thread to improve the readability of their site. Now, it's an interesting thing, readability. You might think that if you graduate from high school, you read at a 12th grade reading level. And technically, you'd be right. You can read something that is written at a 12th grade reading level, and you can comprehend it. You can read it. You can probably tell someone what it says, but you can't skim it, particularly if you're in a hurry. Say, for example, you just got diagnosed with cancer, or a loved one did, and you're looking for some information about it. You're not reading at a 12th grade reading level anymore. The HHS says you might be reading at a 5th grade reading level. And so the recommendation is that all health information be written at a 5th to 6th grade reading level. So Cancer.net knew this. They hired Visible Thread. Visible Thread did an evaluation of their site. And over 2 years, they were able to make huge improvements. 2 years ago, 60% of their content was written at a grade 10 or above reading level. Now only 15% of their content is. And of course, there's more work still to be done. There's personalization work we can do. Technology allows us new opportunities to provide detailed, contextual content that's specific to who the patient is, what their condition is, what their specific comorbidities are. We have opportunities like Sarah introduced us to be inclusive, to recognize that what we say is who we are. We have opportunities to improve our readability through tools, online, through testing, usability testing, desirability testing. We have so much more than what we used to have. We have no excuse for not recognizing that our appointments and our apps and our websites are not the most important things in patients' lives. They have other things going on, and it's up to us to remember that and to help them get the knowledge that they need. And let me tell you, if you are still doubting your ability to do something better, to do something more, let me introduce you to one more member of the Mesibov family. This is Amelia. For her 6th birthday, Emmy asked my brother for 2 things. First, she wanted to go swimming. And second, she wanted to go to the hospital and practice her medical skills. So at the end of the day, he interviewed her. Here's what she said.
This is how we save somebody's life. Okay, so you check their pulse, and if they don't have a pulse, then you do compressions and squeeze a bag of a mask, and then you switch in 2 minutes. And then you keep switching, and then you do a shock if that doesn't work, and then if the shock still doesn't work, then you do a shot.
Very good.
And if the shot doesn't work, then you keep doing it over and over again.
What kind of shot, what medicine is in that shot?
Milligram of epi.
Oh, very cool.
Emmy can administer a milligram of epi. She's already told me she's pretty sure she can skip medical school because she knows a lot. But we can do more. We can intervene earlier. We can save lives much earlier in the process. So let's help everyone understand their medical health as though their parents worked in the ER. Thank you very much.